to Voice of South Pacific, a Pacific Islanders broadcast all the way from Seattle, Washington. My name is Sylvia Fatima Aho. I'm so glad that we are all here today, and I have my co-host, Fololini Nightingale Puloka, and I'm gonna let her go ahead and lead us, with the introduction. Thank you, Lini.
Malo Fatima. Tau whaftai ko toa pe ke o toa I he ne tau himai e tau mo ui o tau au sia e hoa koe ni. O tau I hen whakataha foki pea mo mele koloa tau mo I pe au aho. Ko mele foki na ne lawa I lelei ai ako I he tawhaaki o e Master of Divinity me he apiako koia e ko e Wesley Theological Seminary I Washington DC, ka koe kolomua foki au Amerikani. Na e lawa I lele ai e mele hono Master of Divinity, pe tau kau whataha mo mele I he polkalama o e aha koe ni, ke whakailonga I pe he le tio o e Voice of the South Pacific, ai honga ia I he lava mea kua whai e mele. Pea moha ngahi ako naki pe ko ngahi whaloto lahi e o mai e mele ko uhia ko e toenga ko ia ho tau kai ngatonga I he malae o ia ko I he tapa kehe I he malae o ia ko. Mele malo a pito ho o lava mai, ho taitani lei ko ki he le tio Voice of the South Pacific I he Hawani, ka ko le mua ke whamore mole ka tau kamata at mua halotu, pe e whai pe o e ha tau hiva me he himi ni mangiao fitu ngoful maawalu. Havese taha me ai pa ke ka tak mele o ke whai mai ha tau lotu ke kamata ki ai por kalaman. Malo.
Did you get the hymn? Oh.
Ke tau lotu. Ole pe ke tuku mai whenga mai ke o ni ke whahoko I he lea whapitania, le whaosi ki le. Tau lotu. Spirit of peace, fill all the world with your transforming presence. May the leaders of all countries rule with maturity and justice. May all nations have tranquility and their sons and daughters be blessed. May the people and the flocks and the herds prosper and be free from illness. May the fields bear much fruit and the land be fertile. May the face of all enemies be turned towards peace. God of creation, of planting, growth, and harvest, sow the potential of your word in our lives in the midst of this world. Like seed broadcast across a field of fertile soil, Through the presence of your Son, our light and our life, nurture the tender shoots of faith as they grow strong and tall. By the power of your Spirit, help us to reap a harvest of honest belief, unity, justice, peace, and love. O tua mafi ko mautamai ta ngata ai afiona. Ko koe ai aoniu I he moui ai tau tangata pa mo tau whewhine talu mei mua. I he fiafi whakoloa koe ni eiki ko ke tala mei mua. Ai mahu inga ke tau whakafou e mau moui ke whakafoki ki ho awhio. Hangai fofonga mai o tua tāpo e kina ai polokalama o e fiafi koeni. Ai kau taki, ka pehe ke kau tokoni ko toa pē mo kinau tolu o kau whakataha ke tala a ho o kololia pa mui langi. Ai polokalama mahu inga ko o mai e ngai thim ke mau sio ki ai o tua mahu inga ai ako. Ka koe ako o e mo ui ke ilo a ho ofa o hange ko tala e ko speria sio neo tua. Ko mo oni o mo ui. Ko command menia ki he mo ui a tangata ke mau ilo a ho mau ngahi ngā wha ke ofa ki he tahake. Ko tala e o tua o mau ofa ki ha o tua o mo ui. O ka pau o mau ofa I he lea, I he ngā ue, I he tō onga ki ta tau pa moi whina ngalo a awhio. Whai tāpo e kina o tua ai kautaki ko tō peo mamani. Kai uma a ho mau tui pe moi pale mea ki tonga. Ai kautaki lotu ko tō peo tua. Ai kautaki o ngahi community. Ai kautaki o ngahi family. Ai kautaki o ngahi siasi. Ke tāke kina ho kakai o tua ke nau. Nofo I he ofa mo melino. Pea whakawhonu aki ai koloa a ho a whio kano kato. Ke mau ilo a ho mau ngawha ke oi. Ofa ki ate koe, ke whaia ke tāke. Tāke kina ki mau tolpa moe, toenga o polkalama o e whiawhi koe ni, whai tāpo kina a ngahi kupu kotoa au kau mai ki ai. Ke a o pē mua o tua a ho ofa, I he lea pa moe whakaukau, ka pehe e mau toonga. O mau kole a ngahi meani hono kotoa pē I ho wawhasi su, ka ko mau wha mo ui. Ameni.
Malo au pito. Malo pito mele ai lot whawheta I kamata aki ai polkalamani, pa kono moni, kua tō e ko ngalahi ai polkalama I he lot mawhana kua ke whai o tau kamata aki. Whamole mole pe mele kai tupe mua ke whai hano ki I whamala ala pe a koe, pe mo tupu anga ko uhi ko e si kakai koe o nau whanongo mai pe te nau tok mamata ke tau polokalama ko uhi ke nau ilo I foki koe. Ko mele koloa tau moe pe au aho ko o whewhine lahia o le meki tau moe pe au pea mo aiona tau mo e pea au ko ne mama o atu. Ukai foki tau sola ki a le meki. E ko e tangata ngā au e ia i he pure anga tonga. Na ne whakahoko whatongia i he wa a koe a Ministry of Work pe koe ko i loa koe mou. Na e whakahoko whatongia ia le meki e ngahi tau lahi o au o ne retire me iai. Pea ko aiona ai whae a mele ko ne si pekia. Ko aiona na e hoko koe whaiako i he lautohi puleanga. Whaiako i he puleanga he ngahi tau lahi. Pea na takai holo i tonga tapu na ia o ke ngahi motu i he whakahoko whatongia i he ngahi ngā aue ki he puleanga o tonga. Pea koutu i pe mele ko i ngahi tapu aki ani o e mo ui ko inasi ai he neongo pe foki ai ngahi ngā aue ko tau whakahoko mele i tapa kehe ka koha kakai ko ngā aue au fuato ma ai puleanga ka tau te fito ki o tau ki puleanga ko tonga o ki ai peho no tapu aki. Pea koutu i ko ngahi lama mea ku ke whai mele ko taha ia ngahi tapu aki o ngā aue mālohi pea moe whei lau mo ui aho tangata eiki pea ki pehe ki ho fine eiki i he tawhaaki o whakauwhatongia i he puleanga i tonga. Māloa o pito mele o ku ofalahi atu ki a te koe pea moe tala monu atu ki a koe i he kaha o whakahoko whatongia pea tawange ke whaitongonia i pe koe he eiki. Ko hian koe ngā oe mahau inga ko ke whiri ki ai. Mahino pe foki ia ki a te mautol mele ai tuunga na ke iai ki moana ke lawa me ai e malae o ia ko malae foko ia ko ulahi pe a fere. Ko koe na ke lawa me a koe i he tawhaaki e taha pe a ke hiki koe me iai ke tawhaaki koe ni. Pe oku whatup whiwhiri ia ke whiere motu anta ko tuipe kau pe moha kakai kuna o whanonga mai. Ka aku au ilo pe oku ke ilo ai mea koe oku last long. Ai mea koe o taingata ai ni ku ke whiri ki ai. Pea kou whawhetai lahi ki o tua mere ko hiko koe. Pea moe mama ko ke tuu ai ke uki kakai ke pureanga o tua. Koe whekau lahi foki a mere. Pea kou tau fia ko toa mere i he lava mea ko ke whai. Ka e tukuanga moe taimi koe ni ki a Silvia ki he hoko atu e poro kalama. Malo mere.
Malo e pito whalani.
Ia, malo e pito lini. Koe na pe ko maha ko tukat koe lini. Ka ko whanonga whoki ki he anga koia hono wahe mai. Na iai whakerea a mere na ko manatu i he aho koe na ne wha o siako na ne pe ai whanange ai whine eiki. Ka koe whaiako whukia a aiona. Alu o hoko atu ho ako ka pako e ui ko he otua. Pea koe mea le whai o kui whoki e ka papalangi pa mo ngai whatotolo koe malai whakako. Koe mahu inga koe ia ai a o sia koe e whanau koe parental support. Koe ne sai pea api moi popo e ala kai pe whanau o mui ki ai. Pea koe ia e mele mahalo koe whaiga maari e pe. Whaiga maha o vahe koe ngā koe a o sia koe na ke a o sia ai. Koe ngā ke whanonga ki ai e kainga whanonga kotoa pe me tuli ke wha o e kolope. Malo.
O malo lai atu au pito whalolini ka pehe whoki a Fatima ai ngahi poupou pa moe koloa le lei kua mo whakahoko pe me whalealea. O lawe ho tau monu ki he kainga tonga ka pehe whoki mamani kotoa. Te whoki e ku mana tu mo one au pito lau ka Fatima. O hangepe mo mea i pe whoki ai na o value au pito pe e he ongo mātua koe na utupu hake ai a ko pe mo lotu. Ka tau te whito ki he lotu ke ne whakamama ai a ko. Ka koe os mahino pe whoki ta whaaki o tangata eiki. Ka koe whine eiki na maalie he na o quote ai lea ai tangata eiki koe na aiona ai whine eiki. Koe ne pehe ko sione halali ku whoki ta mai ki hapai kai alu o whae ki ni wadokta pe mali ai. O whaele ko toa hu whanga whatapu e whanau. Pa kone pehe he kai tene langa e ha fale whakawhaofa, ka tene langa e ia I he ata mai koe o ne whanau. Pena mo mea I kotoa pena e osko toa mai me ko pe seti a hiwa whanau na nau tonga I he ako. O, pea koe ngahi tau osi mai mo ui koe whine eki, o ku na whahako mau pe e ma Bible study pea moia. Pea os kamata lewa ku ako online pe ki he apiako kono ko ia he taimini ki he Wesley Theological Seminary. Ai nei kamata pe he online, foi kalasia e ua. Peko ose ma Bible study mo whine eki, pa sio mai o whetakai pe au ia he lomi kon ko e ku laptop. Peko ne eke mai ko ha o mea o whai, pe o talangi. Ko ose ta ako toi tāpua taua. Ko hoko te nia ko o kuai o kalasi o whai ki he apiako toi tāpu. Pea ko ne lean ko ne whakahoko maka te au. Mahalo o kusai ke tuku ho ngā wika ke alo whakahoko e ako, ke whai mo osi. Manatu whako e ko declining e mo uiko ne whine eki, pea fia mau pe ke nofo ofi ki ai ko hinga whako e ne ko ne mo ui. Kai ihe ne lea ko he aho ko ia, hangele wa ko ku ne hanga o hake aki, o bless ia o ke whai mo alu, o whaosi ako. Hangele wa ne whakaatata ia e ia, ka whai mo ha o whaosi ako, ko ne ilo te wiheni, e wawe ko hinga ko resources ke whai ako, pea pehe whoki ki he laiperi, pea mo ngahi kalas kotoa. Pea ko mehena e hoko e Pololini ka pehe whoka Fatima. Ko ngai whale ia ko e whine eki, na ne hanga whaloto lahi iau. He na o whakaamo pe ke alu I he ta whaako ni talu e ku ngā ue pa mo youth. Pea ko ne whakaloto lahi ko au ko sio ko kisi ene mo ui. Pea uhinga I ko ha o whaosi a ko ki whai mo osi. O hange ko ne whalea. O ku ikai ko ngata pe I tā puaki ki whamiri ka ko tā puaki ki mamani kotoa. Pa o whawheta e mo ui ko ngahe ko wa usia. A ngahe ko loa lelei na I sone kia e whine iki ko hinga ko aho ko e ni. Pa ko whawhiawhia ke tala ai ngahe lelei ko ia. Mahalo pito.
Ane nai, ai mahino pe ia, ai tawhaaki nei raki ai a ho mo ui ho lava mea I he mala e taha o ia ko master mahalo I tawhaaki o education pe koe hai mala na ke lava ia I ka ko mana tui pe na aku I hen fe unga mono celebrate o lava mea ko ia na ke whai ai. Pe a koeni, ko lava mea nia I he tawhaaki o theological, he? Pe koe tawhaaki o tohtapu. Kaku, koe kife hui pēwhine motu ani mele. Ko hanai ai mea nane, whakatupunga ai ho he ko tau tolfok tonga ko tau mau pe, tau osnonga ai pe, pa tau nofo ai pe, ai kakai ni. Ka koe nai kai tuku ho whinga, mo ho nofo pe I he tuunga ko ka ke tuku ia e koe ka ke hiki o whai a whinga ko nā ko ke au sia I he taimini. Pea hange koe toenga ia ho mo ui te ke lahi nofo ko I he tawhako ia. Ko hanai ai mea nane whakaloto I koe pe ke whetukutuku me he ki he.
Māloa pita Pololini. Lahi o pita malanga ko whahoko hen pe mo whehu ia I he kolomu. Ka pehe pe mo kai ngā tonga o ko whahoko ngai devotional I he every other weeks. Ko hono tupu ngā, nā tupu pe au ia o pehe pe ko mo ui aku I he businessi. Ai nei mao raki degree ko bachelor I he businessi ka ta whaaki marketing. Nā manako o pito pe au ia ki hono talaki ha mea. He, I he businessi. Tā ko hangeha transition ko talaki nia wholofola towards the end. Pea osi koe ai bachelor degree, pa te hoko atu, pa loto peke hoko atu ai ako. O mao lewe masters I he business administration, ka I he ta whaakia o financial management. Now, whemaba ke challenge eku ilo. Whemaba ke ilo ki no ngā ake stocks mo halfway market koi ki he paanga. But I wanted to challenge ko winga na ke firmao ke alo manage pe te alo hita fa aki ko banke. Ai ko ta fa aki lahi pe na fi ilo ki ai ki hanga analyze o ngai companies ko winga ki ke fonga kon ko en ai alo ki olunga paanga. Pea lava ai ako ko ya. Kako mahal ko ngai mama o ya ko omfo ngai project ke te fai. Pea ko foi project fa mui kon ko ki kalas ko o masters ko ya. Na pau ke mauhanga analyze ha fahinga kau taha. Pako group project ko na kawai na mauhanga analyze ai o ka pehe ka pau ka company na mautolu o mau whinga i ke tukuangi pe ko tuwaki ai a business kon ko ki ha kautaha ke o mai kon ko ki ha ka building project. Pau sia lewa ko ki he mau inga ko o tafaaki ko tope businessi. Pea osi ko ai te ako foki he lao, ako ki he organization, ako ki he anga te mo ui wheohi pa mo kakai relationships. Tafaaki ko tope businessi na ako ia I foi last project. Pea lahi lewa ai tamaiki I he mau kulupu ko ia na naunga ake project he koana hanga manage ia ke na hanga tu waki ake e nau kuminga awe. Pea pako kako I he whakaukau ake taim ko ia na mawahe au me lotu ko hinga he na wako pea ngā awe. Ngā awe taim kakato ako taim kakato pea kale ke taha taimi au ke alu ke lotu. Whe mao ai taimi kon ko he sāpate mo toko na ki ke whahoko e lau e tohi mo homo e ka. Ko foi waha ko ia gap ko ia na o misi au pito. E manako ko ke alu ke lotu kai ke to ia taimi ia. Ai ko te hepe ko foi waha tau ia e ua ki he tolu. Ai ko tau e ua ki he masters. Pala o mesi le wau ke eiki ko ilo konu ke omga te au te whafoki pe ia ki ho kakai. Pea o alu le vai o mawhinga akle mo whātima ki he non-profit organization nau piki au I ngai mea ko iau alu le wau o poate ai. O pau ai ko contribute ko to the community at large. Pea I taimi ta tau pe nau whapapau I lewa ko pau ke unga au e pa mo siasi I he ta whaake o whanau. Pea nau hanga lewa ko piki au ke o alo tali kita he youth ministry. Ko foi taimi a ko na transform e mo ui. Hanga lewa au o kole ke whai whikau papalangi ke ne hanga koneki ai siasi ko ai na tau ke siasi ko he Rainier Beach. Koneki au ki he konferenisi. O mai lewa u resources ko me konferenisi. O alu ko he wako kau taki kon ko ki he leader youth. Pea kamata lewa ilo calling a eki ka te au. Pako taim pe ko ngau whata pe mo youth ka nau pehe pe tau pe tolu te ngau mo youth kau taki ko te mau ngau whata whe mau au ke develop nau tona kau a hokulani. Mau ngau ele lei au pito mau whata ha I konu whengai. O I kai ngata pe whalau maali ka mau connect lewa pa mo u ngawe anga kona ko o mau volunteer ke mahe paanga ke awe ake whanau ki he camp pa mo retreat. Ko kamata le vai ai ngawe ko pa mo siasi mo community pe a o pe ki he think tank ki he state o fili le vai me he university ke o alo hoko ko le o Asia Pasifiki I te pire ko wana ki ono tala noa ai tu unga whakaako kon ko ai kintaka teni ke tahawa ai ko K-12 pe he fo ke higher education na mau kamata ngau le vai mo University go Washington go Seattle University ai ko pe mo tamaiki me tafaaki ko ia me korisi University of Washington na mau ngau whakataha I ngai project ko ia Pea ko taimi a ko e wholoni nau ilo ai oku toi ai ui ma ke hea eiki. I taimi ko nau ngau e pea mo youth ka ikai ngata ai pe fok pa mo state. Kau ke ngau pe fok I he university. Ngai konga mai lewa ko tau ki mui na project fa mui ko I he university ko paanga miliona tupu. Ko ngā kau hanga design a curriculum from ideas to marketing. Pea koe project ko ia nau eke lelewa ka te au. ko kamata fo ke pike ngau e I logo ki ai ko hinga kana ko au na hanga taki a project ko ya pe e ke leva pe e au ke te au pe te ke no fai pe ngau e ko ya o au ke ose mo I pa ko tali nei kai pa ilo le vai ko pau ke hiki ke kumi ke teolosia ko hiki mai ki Washington DC he wafta valu he ako nei ke mui mai pe ngau he ko mantu fo ko project ko miliona tupu o fausi o sia I he kuata uruaki hen pau tok foket ko me malolo fine ki o fa foko to ai u me ngau e na ha mo ye me ngau anga
Whakaloto lahi au pito ki he anga o e whanongo. Pea ko pehe ko e kau koe I he toko tāmonu ia mo oni. Ko uhi ko e ngahi mea ko tope whok mele tau tui ko tāpua ki ai o tua. He? Pea ko ke ngā awele lei e ko e ho tale niti. Pea ku hanko lau. Mao e tale niti, ko toi alo ngā awe I o mao mai moi toi tale niti ke. Pea ku tāpua ki I lewa he o tua. Ka I he makatuunga pe mele e whakaukau atu ko e fuu. Ko e mea kwhai ngofua, he? Ko e fuu whei lau lahi mo oni mele na ke whai. Mahino pe foki o ku iai ho whamiri, ho whanau. Ka koe whei lau I koe ho mo ui kai a usia ai tau mua. Whataha pia mo e whalala o tua. Whalala o tua na ek whai, pia mo e manatu ki ho whine eiki, pia mo e whakaamu nā ne whai. Pak tau ilo loto pe, whakaamu ange nai kei mo ui ke si o mata hei a honi ai mea nā ne whanawhana atu kua hoko mo oni. Ka neongo ia ku tau tui o ku ne fia mai pe mele I he ngā awele lei kua ke whai mele. Pa ku tau fia kotoa ai pe. Ka ku o whaat mele ki a te koe. Ka e tukuange taim ko ni ka Silvia.
Malo o mele. Ko whanau he ngai whamatala whawha koe ni ukai mea ko te to me iai. Taim lai fu tau pehe koe o ia ko whaiwhe kau ko ia ko wholofola tata. Ka nake pehe foki o ko wako I ngai tawha aki kehe. Hange koe ngahi tawha ako mo relationship mo e kai ngā. Hange pe koe public he. Aia o ko mele te whai mai pe maha o ki tāna ki kiai mahana ki ai ha tō tupu ia pa koe hakakai o ku nau whaam ke nau hukat ke tawha ako ia. Tā koe o toi ako I pe ai ngahi mo ui lo tolu ia he. Ai sino ata mai mo lau mari. Mele toi whamore more maka ke toi whai pe maha o vahe ki ai, malo.
Malo apito. Ko ta whaako whoko ne o e teolosiana ma o ai koe ai matai tohi. Ai ana e whate whito lewa e ta whaako ku ai ki public theology. Ai ko public theology ko te hanga lewa ia I he ta whaako na mau sio ki ai o siofi e ngā ue kona e pure anga. Tau te whito ki he kolomu a whoke koe o almea e lao ko me Supreme Court kono whaafoa e lao ko ki he pule anga. Pe tau te whito pe ke taimini, tau ilo pe I he historia ko o e tohitapu, ki he anga ko o lao pe mo kautaki o kuonga, me he sentulu I ruaki o sisu kalaisi o a o mai ko tau kuonga. Pe kuonga whewhele wa hono, ai poupoua e pule anga, ai mo ui ai kakai lotolu. Tau ilo ko tau pe ngahi ta whaake ke hok whai ai wheke aki pa mo wheke aki ai ilo pa mo whekumi kon koi ki he mo ui a kakai. Ka koe public theology whaka oku kaike motu ape oku oia ke ilo ai ngahi whaianga ako eni ihi. Ai nai kamata pe ia mihe apiako kono ko iai. Ka ko osiai pe mo Drew University ko apiako pe ia taha metodisi osiai na matai toki ta I he public theology. Ka kulai whakano e kea. O uhinga ko ni. Ka ko uhinga hano siofi ko tau alo ke public square. A hange pe kon au lau ko e ku alko kau o mo mea ko tope pau pe mo kawai I pau ki ngai ta whaake o lao ko no siofi pe whewhe wahenga o ka kailanu o fe e nau sio ki he taimi o ngawe o totongi whakatatau ki o nau taimi ngawe pe iai pa mo nau medical insurance ki ai mo tawhaaki ke o mo ui. Ai ko ngai tawhaaki ko mau sio ki ai. Pau lewa ke te lau o whalawe ki ai. Poko fe o tua i he lau kono whahau koe pure anga. Tau ilo pe ngahi social issues ke o koko taimi ni mo fe lau a ki ai. Ki he ilo ai tangata. Pako mea lewa ko whehu i e koe mautolu. Ko fe ai o tua. He koe mahu inga te ilo o tua pau ke te ofa ke taha. Ki he taha ke he. Ai koe tawhaaki lahi ako ko hinga ke lawe ki ai. Paku whaamu ke iai a ho tau matakari. Mo mea i pe ko taimini fok koe mahina koe ni o whailonga e sia paswiki. Pea o ko pou a lahi au pito ai alu e tau whanau ke ako i he tawhaaki ke pe o mo ui. Koe hai tawhaaki o nau manako ai pe nau whia mau ke whai ako. Pe nau whia mau ke alu he lao pe alu he medical. O tau monu ia o tau hi whanua koe ni o mao i ngai resources. Koe kole pe ke mātu a ke na hanga pou awe whanau ki he laiperi. Alu ki he whai ako o ka pau sio o alu hi whanau grade. Whetutaki ki he whai ako ko hai whaunga te tau lava o ngawe aki. O kui ai pe ngai resources ia ke omi toko taha ke whatonu lea. Pa ko tau whainga marien ke tau hanga pou a tau kakai. Ke aluha ke ki o lunga kai oa si teke ai pe ki lalo ke ngahi tawhaaki ko ke ilo ia e kakai lanu.
Malo mele katakpe o koe ki whehu ia ni e taha hange whoko ia ko o whakamatala ane nai.
You're muted, Tima.
Katak mele koe ki whehu i hange whoko ho whakamatala koe ane nai ai ngahi decrease na ke raki mao ki mua pia ke toki alu ki hen. Na ke talanoa whoki e tawhaaki o business mo finance na ke mao i ai. I he malae ko ia o e ako, i he mawai ho PA mo master ko e ai. Aia o ko tui be mele kai aiang hao lau o tokon lahi pe ia ai ilo ko ia ki o ngā ue ko ni o kuke hanganaki pe kuke lolotonga whai e taimi.
Malo pito whololini. Ko whehui mahu inga o ke whakahoko. Ko last project kia koe i he masters koe ni. Nei whakahoko i he paanga. Ko inga whako sio pe koe ki he tawhaaki kon ko kuiai ho tau matakari. Mana tu whako teknolosia, pe mo pandemic o hoko taimini COVID-19. Ka aku milionea ko hinga ko na i tawhaaki ko teolosia. Kai whewhe lewa ho tau kakai lanu. Nei whakahoko pe pa i he tawhaaki o paanga, whakatau te whito ki o tau matakari ka pehe ki siasi, pa mo hae tau tokoni ko ki puleanga he text. Ke tau honest ki ai. Ko hae tau tokoni ki he siasi, paanga ko wahe hongo fulu o te mau, pa te whakafoki. Pe ke whai ake ngau e siasi, ko ngā ka lawa e siasi, pe mo i kakai, o whai hangau ki tua. Ke whakatupua e mo ui whalau maari, e ka pehe ki whasosiale, he koe le lei anga pea no tālai e tau toro tau ngau i whakataha. I whanua konu tau loto ki tau nofo ai. Whatata ak pe eni. Ko porkalama ko na iai, whataha pepa mo project wha mui. E ke alewa e au hangi kon ko credit cards. Ka te tau ngau, te hanga whahoko, e ku whekumi ko whekau aki ko mo credit card. Ko kau taha lalahi ko nau own a credit card, o hangi nau targeti nau tole ka kailanu. For example, ka pau e mao ha toko taha lanu ha credit card, ko ne alupako o whakatau, pea o kwai ni i e o vai ai o kai ke lava o totong whafoki. Pea ka pau ko eni, ka pau ko credit card i o panga tahafe. Pea te alu whakatau o mimia o tahafe. Manatu ko policy ko pa ko lao ko credit card i, ka pau te totong whafoki ki mua e aho tau noa, he kai ke to tāna ki maha mea ka kita. Manatu ko tau toltonga, lai ai ngai mea ke hea o hao i hei fo pereti pe ko ia. Pe kalewa ke lava ia taha whafoki tahafe, pe alu folewa interest. Interest ia ko mea ia ko mao e milionea, a miliona ko pe billion e ngai kau taha lahi. Nau tāketi, nau tau lanu, ko ngā koe ki tau ilo ke policies, ko ngā ke tau whai mo totong osia, ka o te tau tā anaki interest. Ai ko ngahi mea nau interest ko ki ai ki a ko i koe o e tafaaki ki paanga ka ulahi au pito ai loloto i ki ai ka ko that's just one of the example na mau discuss lahi he kalasi e taha i he whaosi o sikoni heako.
Malo mele. Fatima?
Malo pito mele ko ngahi whamatala aonga au pito eni pia whafofa ki he tolahi au pito si kau whataha mo ki nau tolu i lotoni ka wai a whaiwhi kau sante ki koliskonga i ka malo pito kau mai e tina ka moto pe whaka mele piu tau malo si kau mai pe whaki ki motol kotoa o mo i lotoni o kai ki ulawa o sio kātoko mo hingoa pe ke kau whaiwhi kau me ngahi wahenga keke whaiwhi kau sio sai awi pe whaki ki a noerini whinau mo whamare more pe kau kai ki ongona to mo hingoa ko ngahi ngoa pe no lava ki usio kai i he taimini kau kai e ofalahi atu pe a ofa ke tau tana ke ngahi popo mo ngai me aonga mele ko inga ko e te tuke ki i minitsi ko ni ke ta e atu ai fo i fasi ko ia ko play fair blow ko foi fast again ko tahine fo ke ne me kau apia ko ia ai ya ko tutuku ko ia Chris Gonzalo te ko ia ko ai
Ko ia.
ange pe ko e kau nga co-host ko ni
Ko e mele ke...
ka ko ni ko so sa o ame ke ka ka te ke ni ko no ko ko ya ho ne ia ka ko ia ko ka QSC ka to ai men ko ai ko ta mo ia ka ko ia ai Chris Gonzalo First of all, we'd like to give a big shout out. Thank you so much, Tino. Mele Kolota Mwebeo Aho. She was our guest and for today, Pastor Mele Kolota Mwebeo, she graduated with her Master of Divinity. Now our second part, Mele, because we have the Seattle King County Public Health. Please, Mele, you can stay tuned, because they are going to talk about the tuberculosis. Pea osi ko ko le atu kai konga whaka osi ke whai mai ha o whaka o ka hako naki ha o whakaloto lahi ki he anga ko ia o i tau whai tau whakako ke whakalakalaka e tau whanau a kotonga mea whetu upe mamana una whanonga mai. Thank you so much. We have our two special guests here from the Seattle King County Public Health. We're so glad that you're here today. And also they're going to talk about the tuberculosis. And we call it in our islands, TB. So it's everybody, like because tuberculosis, it's kind of like a long word, but we call it, TB. And then everybody is kind of ashamed, if you get get sick from the TB. Okay, I'll let you introduce yourself and then we can go ahead and we have some question for you too. Thank you. I'm Sylvia Aho. My co-host is Lini Puloka. Lini and Sylvia.
Hi everybody. My name is Frankie. I work with the TB control program as a disease research and intervention specialist. I've been with the program for about a year now. Yeah, and then I'll give it to my colleague, Mani, to say hi.
Hello, I'm so excited to be here. Hi.
Yes.
So I'm also a disease research intervention specialist with the Seattle-King County Public Health Tuberculosis Control Program. And I've been with the program for about 15 years. And I think this is really important work. And I'm so happy to be here discussing this with you today. So thank you so much for this opportunity.
Yes. You're very welcome. Voice of South Pacific Broadcast. I'd like to welcome these two guest speakers, from the Seattle-King County Public Health. Ko ia ko ki motol whanau mai, ko na tala noan ke mahaki ko ia o ko tabebe ko bacteria, pe ko hana ha o whatonga lele kia lini, ke bacteria, ko TB.
Ko tu o ko bacterias o ko funky ta pepa ko funky siemu o kune mau
ia
ai
ane hanga tama ki tupu
ia it's more likely ko infection pe ko ha ko ngawe ya bacteria I o tau ma.
Yeah, sorry for taking your time. We were just talking about what is the bacteria in our native language so we can spread the word out, for the listeners. Okay, yeah, you can go ahead.
Right. Yeah. So one, thank you so much for having us on this show. So the TB control program recently created a new team, a new unit, and a lot of the activities is going to be around for the team is going to be around raising awareness about TB. So we're really happy to be on this show and doing that work on this show. So we're going to be talking today. We're going to be talking about TB. Of course, answering a few questions if you have any, and then also talk a little bit about the TB control program, right? So I have a few slides ready for us today, and I'll share my screen, right? Let's see. Let me do that. Sorry, give me 1 second. Oh, it looks like I can't share my screen.
You can do it now.
But that's okay. If that's not possible, I can just.
You can do it now. Sorry.
Oh, okay. Got it. Thank you. Let's see. So you should see an screen now. Can you see my the first slide? Okay.
Yes.
Perfect. Yeah, so like I said, we're grateful to be on the show to talk about TB, to raise a little awareness about TB. So going into it, is TB, is it no longer a public health concern? The answer is TB is still a public health concern, right? I do want to share well, in fact, locally, just to share a few numbers, we found that the data shows that it's about around 100, we have around 100 active TB cases a year here in King County. And this chart shows something more related to our community, to the Pacific Islander community. Oh, just a heads up, I didn't say this, but I'm also part of the Pacific Islander community. So this chart shows how it relates to our Pacific Islander community, right? You can see here in the blue that we are higher compared to other other communities as far as TB incidences within our population. So to go further into TB, what is TB, right? TB is a bacteria that normally attacks the lungs, but it can also attack other parts of the body, other parts including the brain, the bone, and the kidney. So TB, if a person with TB somebody who has TB doesn't necessarily mean they'll get sick with TB, right? So that's why there's two conditions of TB. The one condition of TB is referred to as latent TB infection. This is also referred to as the sleeping TB. So what this means is you have the TB bacteria in your body, but it's asleep, right? It's not active, it's not growing. So for folks with latent TB infection, they normally, they don't have symptoms, they don't feel sick, and they can't spread the TB bacteria to other people. The other condition is referred to as active TB or TB disease. So for folks with TB disease, they have the bacteria in their body, and it's active, it's awake, it's growing, right? So for folks with active TB disease, they're often, they often have symptoms, TB symptoms, they're often sick, and they can spread the TB bacteria to other people. So the TB bacteria is spread through the air, right? So let's say somebody with active TB, they speak, they cough, or even sing, right? They can release the bacteria into the air. And also they can infect other people that are around them. So if you're around somebody with active TB, right, and they're coughing, does this necessarily mean that you'll automatically get TB? No. Fortunately, TB is not easily caught. You'd have to be around somebody. You have to be around them for like hours, for a long time, usually many hours or days. Yeah. So again, fortunately, it's not easily caught, and even then, not everyone who breathes in the TB bacteria will get TB. So if you do not have the TB symptoms, does this mean you do not have TB? No. And like I shared, there are two conditions of TB. The first one condition is referred to as latent TB infection. So folks with latent TB infection means they were around somebody with the TB disease, they breathe in the bacteria and it's in their system, but the bacteria is asleep. So they're not sick, and they can't spread the bacteria to other people. There are a couple ways to test for latent TB infection. One is the skin test. This is where they put like some fluid underneath the skin, normally on the forearm, to look for a reaction to see if you have TB or not. Another form of testing is QFT, or also known as a blood test. So fortunately, latent TB can be treated, right? There are treatments for latent TB infection, and this is normally recommended, especially when you're diagnosed with latent TB infection, because this can prevent TB disease. So again, TB disease is when the TB is awake, it's active, folks are normally sick, and they can spread. Unfortunately, they can spread the TB bacteria to other people. And like latent TB infection, TB disease also has, there are also treatments for TB disease. So BCG, the BCG vaccine. If you have it, does this mean you don't have to worry about getting infected with TB? Unfortunately, no. The BCG vaccine, I believe, its intentions were to protect, to give some level of protection for a high risk group, kids under 5. Kids under 5, they're high risk against TB because it affects their brain development. Let's see. Yes. Oh, yeah. And then if you've had, which I imagine would be a lot of us non-U.S. born or who grew up in the state, outside of the States, we received the BCG vaccine, right? So one thing to be aware of when getting screened for TB, right, is the recommendation is to do a blood test over the skin test, because the skin test reacts with the BCG, which can give off false positive, right? So the recommendation is to do a blood test over the skin test. Yeah, so that was just a quick overview about TB, and the messages that we really wanted to give our audience is get screened, get tested for TB. TB is curable. Both TB infection and TB disease. And TB disease is preventable, right? So at the point where you're at latent TB infection, there are treatments available to prevent TB disease. And TB, there's nothing to be ashamed. Having TB is nothing to be ashamed of. Anyone can get TB. You can get it from anywhere. And of course, take all your medications as prescribed by your doctor, right? If you don't, the bacteria can become stronger. So yeah, that's what I had prepared today to share just a little bit about TB. Thank you.
And this is Moni, and I want to talk a little bit more about that concept of TB infection versus disease, because it's a very confusing concept for folks seeking care and deciding what to do with their care around tuberculosis, and even for providers to really understand how important treating TB infection is. So again, TB disease is that condition where you are actively sick. The bacteria, or I guess I can go back and talk about latent infection. Frankie showed you the slide of the little bacteria in the air flying around that you can breathe in. So what typically happens in a healthy immune system is, let's say my thumb is the TB bacteria, it's floating around, I breathe it in, and my immune cells come and rustle it to sleep. Okay, and then it can stay like this for decades, no problem. But TB oftentimes needs a friend to help it break out of its jail cell, right? So in a healthy immune system, these cells will die and new cells will come to replace them, keeping the TB asleep in your body. So I'm kind of pretending like this is happening in my chest. But let's say you found out you had TB infection, you didn't take medicine at that time, and then later you get diagnosed with uncontrolled diabetes. How many of us know someone who is struggling with diabetes? We all know someone who has diabetes. So if they have TB in their body and then they have this medical condition which weakens their immune system, the TB will wake up. And so then that's called TB disease. And that's when you're really, really sick. So not only now are you fighting something like cancer or HIV disease or uncontrolled diabetes, you now also have to take extra antibiotics on top of what you're taking to take care of those situations to fight the TB disease. Because what TB does to your tissue, and we talk about TB in maybe abstract notions, but really to bring it down to something very concrete, it rots your tissue. So if you've ever seen something like a rotten tomato sitting on your counter, that's a degrading process. That's what TB will do to the tissue. It will rot that tissue. So you may have seen in movies, or God forbid you've ever seen this in your own personal experience, somebody coughing up blood and maybe sometimes tissue. That's pieces of that lung tissue that's coming up. So not only are you dealing with, again, like I said, that other disease that's make your immune system weak, you now have to deal with this terrible TB disease. And without intervention, some people can die at the worst. And we don't want that for anybody in our community. We want to be able to eliminate this from our communities all across King County, all across Washington State, and all across the US and across the world, because we are very fortunate in where we live now, where we can get access to medications and medical care to work on eliminating and reducing TB in our populations. But other places in the world, they don't have those resources that we're so fortunate to have. So we really want to make sure that people are really aware this is not an abstract concept. This is real life. And the one thing that's really, I think, is a no-brainer about treating TB infection before it becomes TB disease is that it's taking pills. There's no lifestyle change required. If you get a diagnosis of diabetes, what do you have to do? You have to eat better, right? You have to change what you eat. You have to exercise more. You have to do all of these things to make sure that your life is on track to be healthy. But with TB, what you are required to do is visit your primary care doctor a few times during the course of your antibiotic therapy, take your pills, and what you've done is you've bought insurance. You've bought health insurance this way by getting TB out of the equation. So God forbid you do develop the cancer or the uncontrolled diabetes or the other medical condition. You've eliminated at least that little, well, not little, but you've eliminated the potential for you to develop TB disease. So it's really important to consider this when you or someone has gone and had a TB test and they're found to be positive for TB, but they do a chest x-ray, their x-ray is clear, there's no active disease process going on. A lot of people may choose, I don't want to take medicine now. You know what? I like to drink alcohol. The doctor said alcohol and my turn meds are no good, so I'm going to choose to drink. No, just take, a few months out, take your pills, and then you can eliminate the potential for this, this hardcore train wreck that may happen, because we never know what's going to happen in the future. But again, I think the benefit to eliminating TB, the potential for TB in your life it's really great. And you just have to take pills. You don't have to run 3 miles a week. You don't have to do any extra exercise. You don't have to reduce, how much rice or tortillas you take in your diet every day, like you do with other medical conditions. So please, when you learn or someone learns that they have TB infection and they know that taking medication at that point is optional, take the option, opt in for TB treatment. So, and, we're working really hard at the county health department. We, as Frankie mentioned, we do have this new TB prevention unit that's working on the community level. We're trying to get to people before they get sick. I mean, isn't that the best thing? Get to people before they're sick. You don't want to see people in the hospital. There's also a huge economic impact to people's families when they develop TB. Okay, let's imagine that a quarter of your lung is rotted out. What if you're the bread earner for your family, right? Can you work? Like, let's say your job is you're doing construction, brings in good money when you do construction, but then when you become so unhealthy, your lung is destroyed. You can't carry bricks. You can't carry 2x4s. You can't carry your tools around. Your family does not have that source of income anymore. You have to change jobs. Also, while you have disease, you cannot work because you're in isolation, right? Again, so if you're the only person who's earning money for your household, you are in isolation, you cannot go to work. Or let's say you care for grandma or grandpa. That's your job. It's a labor of love. But you know what? If you have TB disease and you go visit grandma or grandpa, you could make them very sick. So again, let's get rid of TB in our communities. Let's do that. So we are, like I said, we have the TB prevention unit, and we're working, and we're so grateful to partner with organizations such as yours so that we can have these discussions, not once, not twice, but keep it going to keep our communities healthy. So we're working with people in the community setting. We're also working with primary care doctors and community clinics. Because, I did mention that sometimes this concept is difficult even for doctors because we don't see it that often. as maybe some doctors would in other countries. So we are working to really educate and push forward the idea of, if your patient has TB infection, don't just say, oh, that's not a big deal, they're not sick. No, let's get rid of it right now. So trying to work with community doctors as well.
I have a little quick question here. Thank you so much, Moni Muraki and Frankie Era, for all the information. For prevention is better than cure. um, the question is, it's coming from one of the listeners. It's asking, can you suggest, a better diet, like so, because I like to eat a lot. What is something that will help me to stay healthy and not having TB? Or is it from food, or it's from associating with my families or everyone in the community? I think that her question, she was asking in Tongan. She was asking, is there any food that will help, to produce a healthy immune system to avoid having TB, right?
Yeah. Unfortunately, about direct prevention of TB from eating specific foods, I'm not aware of that. So I apologize, I don't know that. But certainly, as I said, TB often acts with a friend. So it doesn't usually wake up on its own. I mean, it does sometimes, but if you have another health condition, such as uncontrolled diabetes, we see that a lot. People come to our clinic, they have TB disease, they're really sick. And we also find out, oh, my goodness, did you know you had diabetes? No, I had no idea. Because their diabetes affected their body so much, the TB was allowed to go from a sleeping state to awake and hurt them. And so they had no idea. So to answer that question in a roundabout way, I think general healthy eating it's always better for us. I know diabetes people would say, watch your carbs and watch your grams of sugar. So that's a very generic answer. I apologize. But to answer the question directly, specifically foods for prevention of TB, I personally am not aware of anything.
That was one of the question, and I was shocked by the data that you provided, Frankie, in terms of the peak in 2021. Can you speak about that? And I'm interested in terms of, does it has a correlation with COVID-19? Because my interest is really based on economic justice, because money, you mentioned that, and I think that is something that we need to look towards too, and also is the data for the Pacific Islanders, because that's peak in 2021, that's highest. And I'm interested if you have done any disaggregated data to find out among the Pacific Islanders.
As far as your question about disaggregated data among Pacific Islanders, I believe there is some level of that. Unfortunately, I do not have that information on hand. Our folks that handle the data be best to answer that, but I can definitely share that to you after this, right? If you want.
Yes, and I will. Oh yeah, I just want
to
say at the state level, yes, there has been new initiative to desegregate our data to see where disease is occurring, so that we can really focus on that, on communities that are being affected more than others, so that we can, level the playing field, that make sure that everybody gets what they need, not just straight up equality, but equity. Make sure that everybody gets what they need to address the health concerns. And so the state has initiated desegregating data.
But my second question is, when I saw the peak in 2021, and you touch on the economic, so I'm wondering about the justice of economic when it comes to, you look at the race-wise, the lowest is pretty much probably has to do with economic, right? The red line, but the Pacific Islanders were the highest.
Yes. And so are you specifically asking why is that the people that have the least get more impacted by disease or?
And yeah, and I'm wondering, because I'm just curious about the peak, the highest in 2021. Is it because they were not access to medical insurance, whatnot?
I don't know what all the factors are that contributed to that peak, but yeah, these types of things we have to learn, right? So that we can eliminate them, so that we can level out those peaks. Absolutely.
Thank you.
And I'm also writing these questions down as well. We have a communications specialist who works with our Voices of the South Pacific. She's been on the call before. Her name is Christina Broderick. So I will definitely ask her that question.
Has a question too.
Yeah.
Well, here's a question to the TB team. Are there any future outreach events that you guys have going on or coming down the pipeline in the next few months or in the summer that we could share out with the listeners of the radio show? Who I'm posting a bunch of your stuff on Facebook Live. We had the opportunity to have Frankie and his team at our community navigator meetings. They shared a bunch of links with us, and I posted a lot of those on the Facebook Live page. But yeah, to the both of you, are there any events that you guys have coming up, or
it's probably
maybe contact numbers where they can partner with you guys to have you guys come to some of their events of our community listeners?
In July.
Thanks.
Right, thank you for that question, Celie. At the moment, there are no hard dates or anything as far as specific, events happening out in the community. We are currently in the works of planning that out. We would like to work with community organizations to develop these events, to plan these events. So if there are community organizations that you can connect us to, this would be valuable as we are planning to do more community outreach around TB, and especially latent TB infection.
Thank you, Frankie. This question is for you. As you
Perfect. Thank you.
As you shared that TB is still a public health concern. So, question is, how long does a person live with TB?
Good question.
So, so a person that has latent TB infection, so this is TB that's sleeping, for many, honestly, they can live out many years, most of their lives, without converting to TB disease, without the TB bacteria waking up and being TB disease. But like Mani mentioned, right, there are other factors that can contribute to that. Diabetes, HIV, pretty much conditions where it compromises your immune system, because your immune system is what's containing the TB bacteria from preventing it from waking up. So once those come into play, folks are at a higher risk of developing TB disease.
So Frankie, as you said that the TB will be lived in with that person for so many years, and like the bacteria sleep and it's going to be wake up later. So it's mean that TB cannot be cured?
Oh, yep, sorry. So unfortunately, there are treatments for TB. So TB can be cured. Both TB infection and TB disease can be cured. Unfortunately, curing TB infection means preventing TB disease, which is what we're really pushing for.
Thank you.
Thank you.
So I'm wondering, Frankie and Mani, maybe that is something that we can push towards prevention for our Pacific Islanders when they go for their yearly check, to make sure that they have that, because I've never heard of it. I've been to my yearly check and never thought of trying to check for TB.
Right, because TB TB among U.S. born, right? It's so low that I don't think providers are looking for it when you do your yearly check. So a part of the messaging that we want to get out there, especially for our communities, get screened, get tested. TB is it's still prevalent where we're from.
Does it cost for testing?
Cost, right? I think it really depends on the type of insurance you have. There, there, there might be some level of cost for TB testing. I'm not too sure, to be honest.
Yeah, this is something that we've been just talking about, that because we know that there's a federal initiative that covers preventative services, and
Right.
TB detection is one of those preventative services. Therefore, by that logic, it should be covered. And so we're really, Frankie and his team, they're actually talking to people who do insurance to ask them for sure, is this going to be covered? Because again, I think it's like Apple Healthcare, that those kinds of medical insurance programs, that preventative services are covered. And this is so clearly a preventative service. If we detect TB infection and treat it before it becomes disease, I mean, you've just eliminated a whole lot of heartache for that individual. And not only the individual, the thing about TB is it affects our families and our communities. If you're, like I said, if you're the income earner for your family and maybe sending money back home, and then you go down with TB and you can't work, I mean, how many people does that affect? It's not just you. It's TB is never just one person. It's at least a family and definitely a community.
Is there a plan to go beyond that in terms of bringing it to the capital? Maybe we can raise that from that perspective.
Yes,
To
that's a good
Biden's
point.
administration in terms of insurance, but also, to elevate our voice from the Pacific Northwest and nationwide.
I think I'll let Frankie answer this from community organizing.
That's a good question. Thank you, Mele.
To be honest, I'm not sure if there's any if there are any political initiatives pushing that. I think the program would want to add their voice in support of that. But I honestly am not aware of any initiatives involving around that.
Yeah, from a policy perspective, what we have been able to do is elevate some of these community concerns to our leadership in King County Public Health and the executive's office. Right now, everything is driven by all things COVID, but as we shift our conversation towards the endemic, right, really talking about those social determinants of health or community concerns that a community is facing, these are one of the top ones. So when I was talking to Frankie prior to him coming on our radio show, we were talking about different social determinants of health relative to food deserts, which gives you unhealthy options to purchase healthy foods. Where are the healthy foods? They're in the richer neighborhoods. $1 spent in the community circulates 7 times. So you are continuing to be bombarded by corner stores, fast food restaurants. But this is a holistic approach, because then Frankie told me, well, think about TB and what it's doing to our community. So in our last, report out to our leadership, we're like, oh, TB is a huge concern. And then I did some research after I talked to Frank and ran into a CDC report from 2018, which states that the Native Hawaiians and Pacific Islanders have 40 times higher rates of TB than non-Hispanics or whites. So it's a major concern. And it's a concern we're elevating to our leadership team. And that's part of the reason why we had them at our community navigator talk. Because even in that talk, I was surprised how many people unmiked, unmuted, and was asking his team questions. So this is definitely a huge issue, especially as we have folks coming in from other countries. So from that policy perspective, we have pushed this to our team to see what we can do. But as I mentioned, we're still in COVID funding and nearing the endemic, and COVID's kind of the hot topic. But I appreciate Frankie, Caitlin, Tom for elevating this to our Navigator program and having them on this show. I know it was a long-winded answer, so sorry.
It's a great answer.
Okay, yeah, I think that is very relevant, that's always brought up, because, we do have our state rep, our local rep, our King County City Council. They are the one that represent us, and take it to the legislature and also the Congress, all those things. But like Melly said, I think that is very important, what matters to us, we have to bring it in, And next week we are invited, to participate on the campaign of our Senator Karen Kaiser and also Mia Gregerson and few others, but those are the time that we need to bring up, our voice and our concern. Because in order for us to choose them, who is our government rep, we need to tell them what matters to us. Okay, thank you. Mahalo ko tau mea men ki he whaosinga i tau programa. I think that is the last question. So if you have anything else to share, and we can go from there. But thank you so much, for the great information, Moni, and also Frankie. Thank you so much.
Thank you so much.
Great information, yeah. Okay, we'll have this little melodious song all the way from the South Seas. It's a little break.
One enough to keep flexible in the building. And yo. Ha! You get to the ladies out there. Sing to the ladies. Let's go.
Yeah, and again, I'll give it to you, to all the hosts, in City Kalepo, if you have anything else, to share with our community abroad. Yeah, okay,
Communications update. I'm going to share my screen here in a second. Share screen to share. Okay. Yeah, this is just more an FYI, just a communications update for May 19th, 2022. No major updates. No major updates, meaning anything brand new that's coming to the table. But I will drop this on the Facebook Live page, but just there's a bunch of frequently asked questions about the booster, about the vaccines. Community is just coming up with some of the questions, and we really are encouraging folks to get their fourth shot, especially if they have any of those comorbidities or immune compromise. This is just a way to keep your family safe. The other thing is there is a public insider blog that was posted, I believe, May 16. It's about an 11-minute read, and it really talks about the booster shot, and it goes over with community some things to be aware of, dispelling some of those community myths. And boosters for age 5 and 11 are now available. The advisory committee on the immunization practice met today to review the safety and the recommendations for those boosters for ages 5 and 11. And not all vaccine locations will be ready immediately to give the booster shot. So I would check your pharmacy, your clinic that you go to, and schedule ahead of time before you go in. So those were two things that I said a lot. I don't know if you wanted to translate that, Auntie Sylvia, or want me to go on to the next slide.
Okay, koina whamanato mai be ko e hoho hono wha ke booster dose. Ako ataya I he taimini ki ataha pe. Pea oku toe o atu whakawhenga Māori koe ni mo whamanatu atu ke mō ngawe aki ai huhu malu I ai a koe takai hono whae ni o kui pe koe booster shot pe koe booster dose ai a koe huhu hono whae ni o a taha pe ki a taha pe pea o kai ngahi whetu o whae anga huhu te koe nuk mau tuku atu ia pea kulava pe ke alat ke ho pharmacy e kanga nau tolu he kulava pe me whai pe o a upe ki ho medical doctor o nau o si lava pe ki ngawe aki ai huhu e taimini koe whamanatu mai pe koe malu I eni o koe pea mo au mo e toko tahkota pe I he community mo society. Thank you, Silly.
All right, the next one is there's actually been with the at-home test kits sent out by the state, which look like this. Look at the due dates or the expiration date. If your expiration date lands on one of these months, they actually went back and looked at it and said you can actually extend it for a little bit longer. So when does mine expire? Mine expires on July. So it actually technically does not expire until October. So if you receive these at-home test kits from Department of Health, do not throw them away on those expiration dates. They put the wrong date on there.
Okay. Thank you, Silly. Kona whamanat mai pe kona e kamata hono tufaki atu e state ai ngai test ko nike ke ngawe ke pe api. Ai kono tukwat ko ni ko whainga Māori e ni ke ngawe aki o me alu o a ke mahina ua ke ngawe aki o whai pe ko o sivi COVID I mo api pe pe a ata pe ia I a taimini. Ai ko na website pe na asset pe ko say yes covidhometest.org. Ai a ko e ngai whainga Māori e ni ke mo ngawe aki ko ngā mo lava pe o sivi COVID pe I api. Thank
yeah,
you,
and then
Cindy.
this website is just one that just lets you know where you can get 10 free tests every month. So community can stay safe and ensure that they are not testing positive for COVID.
Lava pe ke mao e sivi ko ni ke sivi to hongo fulu ka lava pe ko fai pe api. So how are they going to pick it up?
They'll mail it to you.
But how could they know to mail it to you? Do they mail it out to everybody?
No, so you go onto this link that I am
Oh, I
putting
see.
in the
Okay.
Voice of South Pacific Facebook page, and then you just order it up from there.
Ko ia ko alu pe ke pesi ko ia ai Voice of South Pacific o alu pe ko na e asa te website kataki pe e neta tuko ia to e website say yes covidhometest.org. Thank you, Silly. Yeah, we're putting it on right now. Ko alu pe ke pesi ko ia Voice of South Pacific pe ko alu ke YouTube live o ku mau iai e mau pesi pe I YouTube pe he ke Facebook pe te ke lava pe o si o ai ke say yes covidhometest.org ko alu pe ki ai but then I'll send that leva ki api ai COVID-19 test e hongo fulu ke ngawe aki I mahina. Malo. Thank you.
And then the last thing to talk about is just the test to treat program and the testing sites. Some testing sites have closed. Oops, I am going to put this King County COVID test sites for those folks who don't have at-home antigen tests. The PCR test is still available, and the website is kingcounty.gov/COVID/sites. So I'll put that on the Facebook Live page as well.
Okay, thank you. Kona toi tu wate pe mo ufa hino hino ki ha taha pe nei fia ngawe aki. Thank you, Silly.
And that is my updates for this Thursday. The other big one that I have, let me just close this one out, is, where is it? I can't find it. Next week, Thursday. Oh, yep. We have our Pacific Islander Community Conversation Part 2 with Dr. Malik Fuimayono, Scarlett Ekramona, and Pastor Ofalangi. There was a bunch of questions left unanswered and we are going to answer some of those. And we also invite community to ask their question as well. So be on the lookout for that. And yeah, thanks for having me.
Yeah, thank you. Kona te whaafe e peki mō tōlu ko tōro mō whanonga mai. Ko ia ki he tōprelu ko ia wika hau. Ko e kau whataha mo Dr. Fui Maono, Pastor Ofalangi mo e kau ke he peke nau kau guest speaker. Mō kau whataha ko i ngā kau piai ha mō whehui. Ko e time whaika maari ni ke kakai e pasiki. O mai ho mō le opa ka pau kia hau whehui. Lava peke kau mai polo kalama ko ia o wika hau. Ai ko Pacific Islanders Communication ia e lela te wika hau. Lela te pepe me Voice of South Pacific te mau kamata I e ni mai fiafi. O whamore more I he taimi o no ki he fitu. Pacific Islander Community Conversation lele me he o no ki he fitu e fiafi. Pag te whaafe e taipe ko I aho wanima ai a prelulu wika hau. I he Luna Building pe ko I Pacific Highway te mau tupu atu no whaikiki. Ni mātou noa Pulelulu. Next Wednesday, we also have our government leaders in the state of Washington, our state representative, and also our senator is going to be there at Luna Building on Pack Highway. Mia Gregerson and other folks, you know, they will be there. So it's very important. Now is the time to come over and pick the right people that make decision for you. It will be at, the address is 22323 Pacific Highway, South, Des Moines, Washington, 22323. Next Wednesday, May 25th at 5 to 7. Okay, thank you so much, Silly. We'll have a song here. Thank you all. We'll have this beautiful melodious song, you know, another one from the islands of Samoa. And then we'll continue on with Pastor Mele Aho.
Talk about you and me, and the games we will play. Na 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 na. Talk about you and me, and the games we will play. Whoa, 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 whoa. Pangiyale boxingile sami la faiba fika lunga ole masinga senga sewa ke faime aika e pasa fakalue ile musika e vale rock penya ke teno na cha musika mali ele o asumali ike ale kasika mapalo ia hane sel awal fosi ikili ale fale mai unga se sauta telenoa e fe pa ale lile ainga
Thank you everyone for participating and also for joining with us. We're so glad that our part 2 was finished. You know, they were talking about the tuberculosis. Alpha palangi, alpha tonga, alpha hamoa, koi ngā pe koi ngahi whanongonongo mo ngahi vahe koi ni ke ngai mahaki pipi, hange koi ngai mahaki o ku hange ko hangata maki. Pea ko ia e ko loto pe ia o e pot ngau e mo ilele ko ia ai King County ke nā vahe mai ko e tokoni ke whaka watu ki o tau kāinga ai Pasifiki. Tonga, Hamoa, Fiji, Marshallese, kau Melanesian, Micronesian and Polynesian. Ko e hiri pia ki tansi me heni ko tā e te whaiwhas ko ni ka tau alu peheni whaka osi mai e mere koloa tamu e pe au aho e tau pulkalam koe ke aho ni. Ko ngā e ku tau kekehe ake whoki ai hoa e tolu. Aia koe whitu koe tau tolu ko hongo fului ia nau tolu. Pea ko ia e tukange peke ai whangamari ke ne si whano whaka osi mai e tau pulkalam koe ke aho. Mano e tā e te pene tau whai whasi koe ni hima whakatonga koe ni. tuka te kompani ke hoko atu tau te mao whainga maria whaki pia mo pastor mele koloa he lotu tau mai pia au aho ko i ngā ukai ngahi ako nāki pia ko tau whee whanonga ka hane ngahi vahe mahu inga ka ki mua mua ke tau hoko atu ko whaamake whakaau atu ko i ni kusi tohi mai ko e tina kamoto whakalea mai mo whamalo atu i he ako mo e lava mea koe ni ko whahoko pe whoki asna te tu i pulotu ta atu o whātu whaitekau mere koloa pe whoki ki a manase lua ngāwe mo ia he pure anga i Nusila koe ni o kune whakalea mai pe i he ngai polokalama koe ni o ta whahoko malo pita kau mai pe whaka Susana Uhila pe whaka Lindu Liteo te wai pe ke ako homo ngāwe whalotu we malo apitolini
Malo Silvia. Malo mele iho toe whawhainga maalia iho taimi ka ke toe lava mai pe ke whakaosi ai tau polkalama o i aha koe ni. Kai ka tak mua mele kai whaiangi ha o hakonaki pe ko hano whaka ai o o tau tupu o i kai ngata pe whoki he tau tupu kai pehe ki o tau kai ngata o ngā ki he whainga maali e kona o i he malae o e ako. Aina koe ko ke lava i he ahoni pia pehe whoki he ngahi. A lava mea i he kohili na ke whai. Ko ha nai ha o whakaloto lahi pe ko ha o whakai ai si o tau kai ngā tonga he ni hange whoko i ako ke o smau hoa ka kuki kei lava pe o whai ai ako i kai koe whanau pe ka aku hange whakai ai mai au mo Fatima ke matoi whoki loki ako. Malo mere.
o retirement
Malo Pitolini. O whalahi atu ki ngai whawhonga ko toa pe. Kia e tina ka pehe whoki kia Susana. Pehe whoki kia Asnate. Mo e ngahi whaloto lahi ko toa pe. O whalahi atu. Malo Pitolini. Koe mahu inga au pito pe ke tau poupou pe mo te ke tau whanau. O kai ngata pe whanau ka pehe whoki tau tolu. Ai mātua. Ka koe tau sioko ku tau loto ke tau hau ki he whonua muri. Pa ko pauliwa ke hangi ko lau ko na mihi ngahi tokoni me pot ngai mo ui. Ke tau ilo ai ngahi polkalama ka ikai ngata pe ki ai. Ka ke tau whekumi whoki ki ai. Ko inga hangi ko e ni whatata aki. O ku iai whoki ni iho koe ke tau whihoko atu e ako ko inga koe totongi. Koe ngahi kaukulahe au pito scholarship o ata ki e kakai lano. Tau te whito ke Asia Pasifiki. Kaka momo e ai, kau Asia o ko kakai viviri. O ku nau teke pe nau tolu ko inga nau whema o whoke nau alu. E mo mea i pehe taimine o ku whetotoi pe ai ako. A maalunga koe alu ai Asia. Pa pehe pe pa mo Pasifiki o ksio he teira o ksai au pito pa mo Pasifiki. Maharuk mi whika ua whika tolu hake ia ke kau palangi. Kau me lakasi he kau Asia. Tau te whito ke study kona e whai i whaitu kon koi tisi. Ka koe pou lahi pe ia ke mātua, ke siofi pe koe ha e lia o mālohi pe manako ai whanau pa te teke. Ka ua te hanga i kita o pe heu te whiema i kita ke nau aluhe i he waa lao, pe te nau aluhe ta whaaki koe, o koe ke nau manako ke ai. Koe ha pe ta whaaki te sio, pe nau sa ia he sainisi, pe nau sa ia he aati, pe nau sa ia he whaiako, pe nau sa ia i he ta whaaki politika, ki he lao pe mo ngahi ta whaaki ke hango medical, te ke tau whanau ai, koe finance, koe teknolosia, lahi au pito ngahi ta whaaki, pana ia resources, i he taimi koe nau ngāue ai pe moe NAPA, which is the National Association Pacific American. Ko resources ko na nahoa nau tolo omi ke free ki tau whanau. Ko ngā ke nau alo siof poko hata whaako nau mālohi ai. Ka teke lewa ki nau tolo taimi nau ke he middle school pa moe high school. Ko nea ope ko ki high school pa te whenga leo ke te whaofi moe whaiako e te whanau. Ko inga ke nau hanga lewa tala mai ka tau tolu. Ko high scholarship o ata e lawa alo e te kita hini mo te kita masi. Ko mea ko ke te hanga o advocate mai te whanau, but te create relationship mo nau tolu. Ko inga te nau sila o o manako ai matua ke toko nia whanau. He ko nau algo ki sai, ko toi sai ange pe society, ko toi sai ai pe mo tau ngai matakari e whanau muri. Ko popo lahia. Lahia pita matapa o ko ata, ka te oa te whawaiwai ke pehe o koe ke te lawai lea, kumi hataha e ombe he pure anga e toko taha to tongi ke ne hanga advocate ma ki tau tō. O i kai ngā tai hangi ko tau tala no koe ahoni, ko tau sio ka mea whakaawai matapa ke policy change, ko inga ke alua kia e tau to tongi, e tau wāhenga ko insiua mo, o whia mau e ke tau mau. Ka ko inga whakwe ki ha voices. Whia mau lewa ki ha tau whanau pa mo mātua ke teke ai ngai ta whaaki ke koia. Ko whia pita mo poro kalama he kusio o ngawe wa ofi pa mo Asia, pa mo Pacific Islanders, pa mo Asia pe ko inga ke tau whengawe aki i he ngai wa tapa ke pe mo uyo au ki he policy change pe mo pule anga pe he whoki siasi pa mo loto. He ko teke ai pe ho tau ngai whamiri.
Malo mele. Ka takpe koe ki whehui whakaosi e nia, ka ke ka takpe he whehui. O ku mahino pe whoki au koe ngata anga e nia o e tawhaaki koe o teolosia o kui ke a usia. O ku toi ai mo stepu i e taha ke toi kaka ki ai. Kui ai nai hao whakaukau ke toi hoko atu, ki he whainga maari e ko ia i he tawhaaki o teolosia.
Okay, oku mali e tama o pe wili. O ki ai pe ai whakaukau ki ai, ka koe, ka tu koe taimini o swhema o ke hu ki tu a whakakato ngai po kalama. Ai koe taimini whako os provisional elder. Ai koe lelele vai ai he tau e ua minimum, pa te alewa ki he elder. Pea kaka ai pe ki o lunga. Ka ki he ta whaaki koe a ko ki ai pe whakaamu. Ke PhD. Koe apea ko iai he taimini ko T-Min be, a koe Doctor of Ministry, ka koe ko manako apito ki he research. Ko PhD fo koe me ki ta whaakataha o alu he research hange ko tau whanau kona me Pasifiki i he health, pa mo public health. Aia ko research pa ko te whai ako, he? Ka pa te palofesa pa ko a research. Ko manako apito he research. Ka ko tuipe ko mea nau ki kaka i pe ko inga ko manako ko he research o whainga i pe ko ki hau. He ko tau manatu ko teolosia, it's hange pe ko lao. It's a language o pau ki ako tipi aki ai, he? Ako lea whaka akadisi, ako lea whahe pelu. Ko inga ki te ilo ai roots ko o lea, he ko tau whaton lea whakatonga, translate ko o toi tapu. O very surface pe, hange whaka whaparangi. Wa pālewa ke te ako ki te root uhinga koe lea, ki in depth. Ka koe maha koe mea pe e whaam koe ki ai mo ui, ka koe God's willing.
Malo apito mele pe aku whawhiawhia he ko uhi ui ai a manaki lelei pe moe whakaukau at pe e ki he kahau e to iai pe ha taimi pe heni ke tau tala no ai i ha toi lava mea te ke whai. Pe aku popo kakato at mele a e lepio o e Voice of the South Pacific ki a te koe ki he hoko atu a he whainga mele. Mau tui whapapau pe kuo tāpuaki kona ko ke ausia kuo hanko lau kuo tonu a he whawhiangai ia pe ko tui kuo tāpua ki koe he o tua i he ngahi huelo ke o ke inasa i he huelo e mama, ka koe ilo ki he ne wholofola pe mo e tataki kua ke whai i ta whaaki o teolosia. Whamalo at mele ki o taimi, malo au pito.
Malo au pito, o whalai atu.
O whaaki.
Mele koe mahala koe ki koe wha o si peni, koe whoki pe ki he ngahi wahe koe na ke ngawe aki ai ke tokoni aki ko ia family support mai tokoni ko ai mātua. Pea pei mo ki whine mui e taha, maha ko tui ko toko tolu. Ka koe osi men me university ko ia o iloa ko Vanderbilt University, maha te ke ilo ia e ko ia. O tu ia i Pekoa. Nashville, Tennessee, Aia ko i moko punaini o siu pea mo talo tu i fua. Ko ki ofe fine o peata tu i fua, ko ki tahine ko ana whanonga ba inga stringer, Aia kone graduated mo na Bachelor of Arts i he Earth and Environment, E ta whaaki koe ai whanua pia mo e kere mo e atakai, Pia oku whakailonga i a pongpongi, ku na whakaafe pē ko e amana ke whakahoa ko ia i he taimini mai whiawhi i he Federal Way Community Center. Aia ko e she's graduating with her Bachelor of Arts in Earth and Environmental. Ai ko ana whanonga ba inga strinka, ko ki ofe whine ia o peata tu i fua. Pea ko e hange koe lau tau whia whakatahe pē, ko e whakmoi ki ofe whine o Oddly White. Moko puna ia o tui hakavalu ka pe whoki a lua hefa. Ko e te nau toki kau whatahe mai te tau toi kau whatahe polo kalama o e aha moni te o ku te waki e polo kalamani ke tātā naki mai ki nau tolu e kau wha ose a ko me ngahi au sia. Pea ko tui whaka ko te sia tu koe me atakai mele kui kai ke whai halau lava ka koe tau uhi ngā pe o ku iai e te sio atu ki e mātua o ku nau pōpō i koe nau whanau ki ta wha koe ni pea ku nau au sia le vai. Ko iai mele te tuka peke wha osiangi mahino o pito ngai whamatala whafoofa koe vahe. Ko hānai hao palani pe ku te ke toi whoki mai pe te ke hoko atu pe iho mou wheitu u. Pea ko hā pe hao whakaloto lahi ke whaka osi aki e tau polokalamu e aho ni. Pea mo e te waki ngahi ngā ue o ke amanaki ki ai ke kaha u. Malo.
Malo pito Fatima. Ko tupi ko e whehui mau i ngā upitoin ko i ngā ko lawa ai a kope mo whinga. Pea ko whelewa ai ta whaaki ko te hoko atuai. O ku kai ke ngata pe whakeleti o ka ku ai pe mo po kalama e taha o ku tokoni ai ko mimi ko nimango futupu ia mi mamani. O ku tune in lewa whae nau devotional every other weeks. Pea ko e tu ko he taimini o ku ke ngā ua pe hen i he seminario. Ai fo na nau ilo pe osko ti se mapa nau kumi lewa ta fa ake fai mo hu ki ai ko nga ke nga we ai ai o ko lo tongo ai pe ko nga ka fa osia ana puri na ke fe ma ke foki at lewa te ke osia me heako to osia ana puri ki mai na katu ka e te pau ke alo atu ki fa no fo o fa ho ko mai na katu. Pea koe hoko atu o te kepe ke fu mahino pe te whoki atu o ngau o si mahino pe ngai ngau ku ata me hena. Ka koe mahalo pe te hoko atu heni hata o e ua ke ta o tolu. Pea osko e pa toki whoki a te ko ungai na palo mesi pe pau ke whoki o ngau e mai konferenisi. Ka koe tu ia koe taimini o te pe ke ha mahino mahalo pe ke hawike e taha pe ua me heni pa toki mahino ai. E lava pe ke o ngau e me heni. Ka whia mau pe au ke whoki o ngā he ministry ko ngā koe me e pēna o ako ai. Neongo whia mau e whai he api a koe ke hoko atu o ngā ue mai seminario. Ka koe whia mau pe ke whai mo ngā ue ke ministry patok hoko atu ai pe. Ka te ke whapapau i he taimini. Ka whihui mau inga malo.
Malo o pito mele ko tui ko e ngahi ako nakia mai vai o ke o mai ko o si hangeu lau.
You're muted,
Mata o pito ko ngā ke toi whoki pe ho whakaukau. Pa koe ke ngata i ko mahu inga ko i ho pou ko ke ako ai ki o whiwhine a ana puri ki vai lahi aho. Ko i ngā ke ilo ko pau pe ke i he tawha aki. Parental support is always there, he? Ko pau pe ke ia e pou turiki o i whare kai lava o langa, he? O ku ke loto pe ke whanonga atu ko whai ho whikumi ke ngahi tawha ake kehe. I e ngahi ātakai mo i mala e o society tawha ake whakalotu. Kana ke awe pe ho ki tamā ko i ngā ke mo alu pe o ako whataha pa o ke kei pou pe. Ko mea ia ko tau whiwhia he whanongo ki ai. O kai ke i tuku noa i neong ho alo whenga. Ka ko ke efi pe ho ki i tamā e tawha aki ko i ngā ke loto. Ke whai hono tokoni i, whai hono hinoi i. Ko i ngā kene mau haka hau lelei. Pea kou tui ko e mea ia o ko ne ako na kina mai ki tau whanongo ki ai. Ko e hāpe ngahi mea te tau whai. Ka pau pe ke tau whi pou aki. Parental support, family support is the number one thing, he? E ko tau opa tuko e tau whanau ki whare ako. Ka o ko toi mahu inga fo ke whai ho tau e tau ngāwe ke tau toko ni i pe mo pōpō. Kai ko ingai pe te rea whakapālangi pe i kai. Ka koe sia pe whanau te toko ni pe mo e pōpō. Pea ko tui koe lava me aia mo e mea ia mahu inga. Pa ma wha mālo lahi heni. Mere mālo apito e polokalama whafo ofa ko ke tuku ho taimu. Ka ke vahe mai mo e whai e whakamama ki he tau pōtala noa i he aho ni. Ko ia ko anga ia. Pea ko ia ku ia pe amana te tau te program pe ka u ma fa malo lahi atu pa te mau kore atu heni ke whai mo a tau lotu tuku ke resi ai pe tau polokalama aho ni pe a tau osi ai pe malo.
Malo la eta bito Fatima ka peka fololini pea atu tala monu ki he teu kona o e wha siako pa mo e wha fia family o teu ki wha hoko he family o he wha ki he weekendi. Ke tau lotu. Mau whawhetai e ko ngā koe mo miniti whakoloa koe ngu ki wha inasi aki ki mau tolu ai koloa ofa aho ai whio ki whahinga o e tangata, pia mo e whiwhine kotoa. Eke o ke aku ne kina ki mau tolu i he tapa ke he kehe o e mo ui, o i kai ngata pe ke mau sio ka ki mau tolu ka ki mau sio ka ka mau ngahi kupu kotoa pe e society. O e family ka pe hefo ki he society kotoa. Ai mau inga o tua ke mau lea i he lea o mo oni pe ato tonu, ke mau tala ia ke hā ki he taha kotoa pe, ki he mao lalo, ki he mao lunga, ki he ilo pe i kai ke mao hamatai tohi, ke mau treat e taha kotoa pe i he whapapa mo oni, ko mau tala ia o kua e mau o tua mo ui. Whai tāpua kina ki mau tōhono kotoa eiki i he aho koe ni, pa mo i whiaf koe ni, ka pehea ki nau tō, nau whanongoa ai leti o. Whai tāpua kina e ngahi kautaki kotoa pe, o whengawe aki pea mo Fatima ka pehe ka whololini. Aki nau tōlo kau whanongo. Whai tāpua kina ki nau tō mo ngahi whamiri kotoa. Ka pehe ke whanau o teu ke teke, pea ke ako i ki nau tō ke tālai pea langlangi ho awhio. I whanua o kumau iai, pea mo e pehe ke kahau o mamani o kumau iai. Whawhetai e ke ofa, ko hinga ko ki wha inasa ki mau tōlo ha o mama. Ka i kai ngata ia te ki mau tō, ka mau whaalea, pa ki mau whaha ki mamani, ai ngai koloa ko ia o ke omi wha inasi aki ki mau tō. Whai tāpu kina ki mau tō, koto kotoa pe o tua. Nā amo mau ngai whiri o ki mau kole ki whai tāpu kina o awhio. Toko ni a ki mau tōlu, pea ka ia hataim ke mau tō e whoki mai ke langi pe ho awhio, i he lea o ki mau lea aki, pea mo ngai mea o ki mau wako aki. Mau kole kotoa pēni ho wa whasisu, ka ko mau whamu ui. Amen.
Amen.
Malo apito.
Ta e tai pe tau Playfair Blue whaosi aki ia. Malo pito mele ma o
Whawhalai atu, malo ti.
Malo pito mele, o whātu.